In the industry, and really in everyday life, we have found that it is hard to have a good reportable measure on how you or residents are really feeling. There are rating scales and questionnaires, but those are subjective and don't produce metrics we can use to show families what we are doing on the day-to-day to keep their loved one happy and engaged. We all know that loneliness is a problem in long-term care, but COVID brought on a whole new level of loneliness, and now depression affects 48% of residents in long-term care. So now, more than ever, residents living in these areas need additional support to elevate their moods and be checked in on a daily basis. Residents living with later stages of dementia, who have had strokes or other medical issues and have become nonverbal, have a hard time expressing emotions, and as support staff, that makes it difficult to report back to families about their mood or emotional well-being. We had a resident that had a stroke, and the way she expressed herself after the stroke was she always cried. When she was happy, she cried. When she was sad, she cried. So how can we tell the difference? We can now use artificial intelligence, or AI, to read her microexpressions to help us get past the crying. As you know, employees are constantly trying to find ways to interact with residents that face these challenges. And with COVID and all of the restrictions that have been put in place, sometimes employees need a breather or an outlet without leaving the floor or residence area. I was looking for a solution to this problem that took engagement past just playlists and music. And through networking, I found out about Solo AI that was created by a grandson who wanted to build a meaningful connection with his grandma and improve her well-being through personalized music. Solo AI is an app you download onto existing tablets or smartphones, and no additional hardware is needed. The app analyzes your face in 20 seconds, gives you a personalized emotion-based recommendation, and then monitors your expressions as you listen, all while collecting data. The app provides the ability to analyze and improve emotional well-being with an easy-to-use interface that enables residents and staff to engage in personalized, time-based activity after reading their facial cues. The app looks for these micro expressions that are then turned into one of these 7 emotions. The setup is easy. Solo initially loads the residents into your community profile, and once in the app, residents or staff just click on their name and the time limit desired. The app reads their facial expression and determines their mood. And the amazing thing is that it learns and adapts every time you use it. Based on your mood, it gives you a recommended mood playlist, and you can choose from a list of choice video areas: listen, smile, relax, travel, create, or socialize. After your session, the app produces metrics on each resident that can be shared in reports, with family members, with healthcare providers, and EMR systems. It also produces metrics from a community level, so your leadership team can see how the residents are doing as a whole. The metrics have shown that with only 15 minutes after your first session with the app, that it decreased stress, pain, and loneliness, and most importantly, increased moods by 90%. Happier residents equal happier employees. Another unique feature of the app is that it also speaks many languages. Not only does that fire off neural paths that don't get challenged on the day-to-day, but it has helped us get to know residents better. We had a resident move in that didn't have any family left, so that left us with no history. When they started using the app, we learned that they knew French. We connected them with a resident from residential living that speaks French, and now they meet weekly to have conversations. Many of us have done surveys and questionnaires, and with these metric tools, residents will sometimes tell you what they think you want to hear, or they will answer with a standard response: "I'm fine," or "things are good," or you can't get a response at all. But with the app, it gives you feedback in real time and reads their face and assesses their mood. and it does this without needing any medical history or without asking any questions. You can use the app in multiple settings. In residential living, you can have a device set up in a common area and go through a 5-minute session, and the resident can have instant metrics on their mood. In assisted living and long-term care, it can be an additional one-on-one activity to improve mood and loneliness. In memory neighborhoods, it can be used as a treatment for wandering, distress, aggression, or agitation. We consider Solo an extra professional to the team. For example, in the memory neighborhoods, when employees get stressed and have used all of their redirecting resources, they can use the app to engage the resident, and the employee can have a breather while still being there overseeing the space. It can also help new employees get to know the residents better by taking them through a session. Through the session, they are able to watch and see the residents' interests and see what makes them happy. We have just finished up the pilot phase with 20 residents, and we're excited to share the metrics with families. It has been exciting to actually give family members a printout of their loved one's mood and happiness. It has raised our quality of care and adds a feature that sets us apart from our competition. We started the pilot with 3 tablets, and throughout our pilot phase, one of the biggest challenges we faced was wanting more devices to operate the app with more residents who couldn't leave their rooms or needed it more often. Working through this barrier, we used company iPhones that weren't originally intended for this use. This is one app you can use in multiple settings with different purposes and results. You can use it in a group setting, a one-on-one activity with in-room engagement. The staff can use it on themselves, and it can be used in a common area. And the biggest pro for me are the emotional metrics for each individual and as a community that you can share with family and leadership. The cost is $5 per person per month and is available 24/7 and simultaneously with as many residents who need it. When you compare that to hiring a specific person who is only there a set number of hours a day, it is a win-win combination. The app has helped us reconnect with residents after COVID. It has helped us get residents back out of their rooms and back socializing with others after they couldn't for so long. We are happy with the price, the impact with the residents, and the reports we can give the families to show that they are well and well cared for. This has been a lifeline for us during a time when the residents, the families, and the organization needed it.